Morning, and Dr. John Heimke joining us in studio this morning. Good morning, doctor.
Good morning. Pleasure to be here.
And what a lovely smile you have.
Beautiful, right?
What I say. Now, just in case you don't know, the Wave at Work contest is the wave phrase that pays. The grand prize this month is a smile makeover, courtesy of Dr. John Heimke.
Wow. Beautiful. You have a beautiful smile, Dr. Heimke.
Thank you.
That's his calling card.
And our winner, our grand prize winner this month, can have the same smile. It's amazing what your smile does for you.
Well, now, something you might think about, too. You know, when I first heard we were doing this, I thought, well, you know, only somebody with a severely, what's the word I'm looking for? I don't want to say deformed, but with a lot of problems in their teeth would be a candidate for this procedure. But you can take somebody, you were just showing us pictures of your hygienist, and she looked, you know, okay. But then you showed us the after, and it was just amazing. The difference it makes. So anybody could benefit from this, really, right?
Absolutely.
Oh, sure. You know, a lot of times people think that they have a good smile. But then when we start to talk a little bit and we take some photographs and we do some digital smile designing, I can show them the possibilities.
Wow. Possibilities are endless.
And it's quick in most cases?
The average smile takes about 2 hours to do.
Wow.
That's crazy.
The same day. That's what I'm thinking. You know, before veneers took, weeks, if not months, to get everything?
Well, it's a multifaceted procedure,
okay.
But really the change occurs in about 2 hours, where we fabricate a prototype smile, and then things are made at the laboratory, and then we finally deliver the smile. I love the word delivery because it's
yes.
You know, it's like a birth. It's something new, and we do that about 3 weeks later.
So then, who's a candidate?
Well, we've gone from 15 years of age all the way to 93 years of age.
Wow.
And so really we need to have the patient come into the office. We need to do a consultation, and then we can provide a plan on how we're going to get to that endpoint smile that person wants. I always say that a smile can be your passport to all that life has to offer.
Well, you were saying off the air a moment ago that really there is actually, in many cases, depending on what you do, an economic benefit to having this done.
Oh, sure. Malcolm Gladwell, the author of Blink, Outliers, David and Goliath, he recently said that a smile really is a sign that you've made it, or that you will prosper. In fact, studies have shown that people that have great smiles or have had their smile done, they do about 10 or 15% better than the average person, economically, socially, so all around.
I can believe that.
Well, it's going to give you more confidence, I think, quite a way.
Absolutely.
Because you can tell when someone, they don't like their smile, and they kind of hide the smile in a photograph, but I think they also kind of hide socially a little bit, too.
Oh, that's true. And I've had patients that come in that say, you know, when I go to work, people think I'm an unhappy person, and I'm really a nice person.
Yeah.
They get their smile done, and everything changes.
Right.
And they're like the hit of the office or the hit of the social scene. So it really transcends, you know, age, sex, race. And it's something that, if you're really not happy with your smile, do something about it. Come in for a consult. Visit my website, everyonelovesmysmile.com. It's video driven.
Do you have a lot of examples there, like before and after examples? Because it is such a visual thing.
Yes, we have a page on that. I have thousands of pictures I can show people if they really want to spend the time. But the nice thing is we customize the smile for that person.
Yes.
So you're not getting an off-the-shelf smile. You're getting something customized for you. I'm using facial aesthetics. So we're enhancing the face through the smile. The smile is the center point of your face. And when people make connections with you, be it in business or socially, they're making that connection within 30 seconds.
Yes.
Can you imagine 30 seconds, somebody's going to make a decision about you, and you might not have even chatted with them.
Right.
But they're looking for that smile. So if you say you're going to meet that special someone, you know, let's say it's in a social setting, that connection will be made almost instantaneously. And if you don't have that grabber of a smile, you may not get the satisfaction that you're looking for.
Right, because usually they'll say, what attracted you? His smile, her smile. So that's one of the first things that people notice.
Well, the thing that I like, too, Doctor, from what I've seen this morning, and first time I've met you, I didn't know you before today, is you're not just a doctor, you're an artist, really. And you're what I love about the few examples I saw is it looks so natural. It doesn't look fake at all. And you were talking a few moments ago with Grace about making sure it doesn't look like chiclets or a shovel.
Right.
Exactly.
Or I've seen some back when veneers first came out.
Yeah.
And like you said, it's geared toward, it's customized for that person, the individual. I've seen, and this was years ago, where they looked false.
Mm-hmm.
They looked even like I don't want to say horse teeth, but they kind of just had a long appearance, and they really weren't complementary to the individuals.
Well, it is the artistry. You know, it's a combination of health and artistry. And the artistry, there is some skill with that. You can learn it, but it's also some skill. So, and it's also, I tell patients, you know, some people like Cézanne, some people like Picasso. And so there's different dentists that concentrate in cosmetics, and you might meet different dentists, and you've got to decide which style you like.
Yes.
And so that doesn't offend me if someone says, well, I like Cézanne better than Picasso, and you're the Picasso guy, so I like the Cézanne. But most people actually like what I do.
Yes.
And I really try to customize that smile to them. We design and sculpt right there in the office. And then we let the patient wear that smile in a prototype form for a period of time so I can make some corrections, and the patient can even give me some input.
Wow.
I love mysmile.com. Is that correct?
Everyone loves my smile. Everyone loves my smile.com.
Dr. John Heimke, thanks for being with us. Will you hang around? Will we do the giveaway in a few moments?
No
because
problem.
they'll be qualified for the grand prize. Dr. John Heimke with us this morning. We appreciate him being here very much. Smile, everybody.